Hello everyone, I'm Dr. Tiffany. I'm a dentist at a Dental Designs Clinic, and this is another episode of Before and Beyond, where we take you through case planning and considerations that we look at before we start the case with the patient. I do a lot of Invisalign at the clinic and like orthodontic treatment. So I'm showing a case today, which is about that. On the screen, you will be able to see the patient this is the original condition. So what is happening here is that her main concern is her front teeth are quite protrusive. They're coming out in front, as you can see here from the side as well. You can see that it's jutting out, and some of the teeth are also more inwards, so it will look like they're smaller, doesn't look as even. There's a lot of overlapping there. And also on the bottom as well, we see overlapping because there's not enough space, and some of the teeth are very rotated, so they're very turned away from the straight position. And when we look at the back as well, we can see that some of the teeth, they are not in line, and some of them are leaning down, in fact, towards the tongue side. Looking at the back at the bite as well, we can see that it is a crossbite. So a crossbite is when the top teeth and the bottom teeth, they are not in a proper position in regards to each other. The top teeth should overlap the bottom teeth in order for the top teeth to guide the bite and how you can bite together, how the jaws can fit together when you chew. And in this patient, we can see that on both the left and right sides, we have a crossbite on the molars. And in this case, it's actually not too bad because it's on one molar, but we will be fixing that as well. The other thing that we see when we go to the front is this tooth. This is the canine tooth. It looks very wide here, and it looks a lot bigger than the tooth behind and in front of it. This is because it is rotated, so it's in the wrong alignment. You can see how it's turned away. Instead of being, if we imagine, the other teeth facing that way, this tooth should be around here when facing that way as well. So this is quite a severe rotation we have here. And interestingly, on the other side, it is also the same. We have a canine tooth on the left as well that is rotated away from where it should be. So let's go into how we'll fix it. Firstly, when I look into the case planning, I will look at not just the teeth, but also how the smile is. So when you come in for a consultation at our clinic, we will take a photo of various angles of the teeth and how the smile is. And that is to show me how the teeth are. So before, this is the sort of simulated outcome that it should look like, and this is the original position of the teeth. So you can see that because of the position of the teeth, the smile doesn't look so nice. And I'm looking at how the front teeth look a lot larger than the rest of the teeth, and they look like they are also very forward. They are sort of the first teeth. When you look at the smile, you sort of stare at them a bit more because they are more prominent due to the position. So when I look at this, I'm thinking, I should bring these front teeth back. It will make, as we bring them back, it will make them look smaller and more in line with the rest of the other teeth in terms of the shape and the proportion. The other thing we look at is to the left of the front central two teeth. The side teeth are also, as we saw before, it's underneath or overlapped by the front teeth, so they look very small. And then the corner one, it looks like it's sort of more outwards. It's bulging out compared to the two next to it, and it's pressing a little bit on the lips. So these are things that I want to bring in. I want the smile should look like it fits within the mouth. It shouldn't look like it's straight but it's still protruding out. We see that sometimes. So, and also the lip line, in this case, we don't see much gum. So we have to be careful where, as we straighten the teeth, we don't move the teeth such that it shows more gum or it shows less, even less gum. We want to sort of maintain a good 0.2 mm is the rule of thumb. So 0.2 mm of gum showing above your central incisors, which are the front teeth. That is a good guide of how much gum we want to show. So again, I go back to the teeth again, having looked at the face and having an idea of where I want to move the teeth. And in this case, we can see there is significant crowding, which means there's not much space left that we have to move, and we need to create more space. So typically, in many or traditional orthodontics, the way to create space would be to extract teeth. But I am not, to me, if I can get the space somewhere else, then I will try to do that. As well as I've also seen the patient in real life during the consultation, and not just the frontal view, we also have to consider the side view. So from the side view, her facial profile was quite good. It was just her lips were protruding out a little bit due to the teeth, but nothing too serious. So in this case, I wouldn't want to extract teeth because then it could cause us to push in the teeth a bit too much, and it could cause her facial profile to flatten. So in this case, what I will do for space is called expansion. What I do is I move the teeth to widen the smile. So I move it out a little bit and some rotation as well. You can see I'm fixing that as I go along. So a little bit of expansion, and this will result in a smile that is more wider. So as like some people smile, you can see more than just the front 2 or 4 or 6 teeth. You can see more like a wider smile, and sometimes this is associated with like a more cheerful personality, or it less of black spaces at the side of the cheek. In some people, less of narrow or small smile. It's quite interesting. They've done some studies where the perception of the smile is not just straight teeth as well, but like whether the smile is narrow, wide, how many teeth show, how much gum shows. There is a difference in how people perceive that. And in people with very broad smiles, it's perceived as more sort of outgoing, cheerful. Of course, it's not. I would say we have our own unique personalities. We don't want to, let all these define us. But maybe if you feel like your current teeth don't reflect your personality, then you could, as you do the orthodontics, you could also let me know, like, oh, maybe I prefer a wider smile. I prefer having, I have some requests sometimes, like I prefer having my canine teeth being more prominent. I prefer my front teeth to look smaller. All these things I will take into account, because I do believe that the smile has to be unique, and it is a reflection of your personality. And teeth we want the teeth to look nice, but it has to also look like you. So right now I'm aligning it, and as I'm doing that, I'm also looking at the teeth from different angles to make sure that it looks okay. Because if we go just from the front and look at it, it sometimes doesn't tell the full story, especially if like in this case there's some chipping of the teeth happening already, so it could sort of skew our perception. Like, from the front that looked very straight, but as we go to the side, we can see that this tooth is actually turned more outwards, and we will want to tilt that in a little bit, and also to push the other ones out a little bit. And then we look from the side again, and those front teeth are still protruding quite a bit. So I want to bring that in. So what I'm doing here is called 3D controls in Invisalign, and it's a optional feature. So how Invisalign works is that as you send in a case, they do propose like a default plan for you, but I don't go with the default plan usually. I would always customize the plans because the default plan, the person that's generated it, or maybe an AI maybe that's generated it, they haven't seen the patient in real life, right? So it's not, it's going to give you straight teeth, but it may not be, sorry, that's wrong there, just whoops. Okay, but yeah, it may not be, the automatically generated version may not be actually the most optimal. So I always try to optimize all my plans, and that takes a bit of time, and often I go through a few versions. So this is like right now what I'm doing. This would be just the first sort of draft, and then again as we it's a process that involves quite a bit of back and forth. So I do like a draft here, a design here, I send it to Invisalign again, and they tell me how many aligners that is going to take, and then I take a look at it after they are done with that, and then maybe we might have to, sometimes on a different day I might change certain things, or I might notice things I didn't pick up on earlier, and I redesign the plan. So it does take me a bit of time to go through each plan after the consultation, because I want to make sure that the plans are as good as they can be. And right now I'm doing the bottom teeth. So again, we can see some teeth, they look kind of almost alright, but you can see that it's slightly turned to the back. The angle of it isn't quite as good, so I want to correct that. Yeah. And how Invisalign works is that every movement that we do, that we want to do on the teeth, it takes a certain number of aligners to be able to achieve. And each aligner is like the plastic that you wear on the teeth, like the little cover that you wear on, and each one of it has like a little bit of movement built in. So that's how it can straighten it gradually. You change the aligners after 1 to 2 weeks, and that gradually moves your teeth. Yeah, so I'm looking at it from all angles, and I can see that angle of the tooth is still not right. And we move like that a bit. Yeah, and as we move the teeth, you can see because it was quite rotated before. I'll show you it again. The two teeth in the middle, they were sort of crowded against each other. They were like kind of squeezed together. And when we when we straighten it up, this space opens up, and this is called a black triangle. So a black triangle is where the gum between the two teeth hasn't really formed, or is receded down, and it's exposing that little gap between the teeth underneath where the other teeth are touching, the rest of the teeth is touching. So this black triangle in real life is not quite as large. It would look kind of like that, but it is a bit darker. On the bottom teeth, maybe it's not as obvious, but many patients would like to reduce that, and actually it's already been reduced, because without doing those numbers you see there, it's called shaving. So that's the other way we get space from expansion, just now what I did. And also shaving a little bit of the tooth away to create a bit of to straighten the sides of the teeth, and it creates a bit of space between the teeth that we can use to bring the teeth closer together, like what you see here. But and often it reduces that size of the black triangle, but it may not be able to take it completely away, because you can imagine to remove that completely, I would have to shave the teeth all the way here, and that's a lot of tooth to remove. So we always have to have a balance of what is healthy for the teeth, and as well as the aesthetics. We want to make sure that as we move the teeth, it is not causing damage to the teeth. And some people might ask, what is shaving? What's this shaving about? I go through this in my consultations as well. So shaving is essentially removing a bit of the tooth, making each tooth slightly slimmer so that we can get the space to straighten the teeth out. And it does damage the enamel a little bit because we are removing a little bit of the tooth. We don't want to remove too much, because then it becomes, if the enamel is too thin, then sometimes it goes into the second layer of the tooth, which is called the dentine. And the dentine is softer, it's not really able to protect against cavities. So that's why we don't want to do too much of that IPR or shaving. Yep. So 0.5, what you see here is quite a safe amount. The maximum I would personally do would be 1 mm, and this is between two teeth. So if it's 0.5, then it's around 0.2 mm to 0.3 mm on either side of the tooth. Okay, so we have something that looks a bit straighter, but if we go from the side, we can still see like the angles of the top teeth. It's still sort of angled outwards. It may look still a bit more protrusive, so we want to bring that in. Just the angle of that in. Maybe more on this side as well. Turn that off so it's not so distracting. Yeah, so we get a better angle. And then this tooth, yeah. And then here, something that's quite interesting is you can see from this view, the jaws are usually not symmetrical. So the jawbone, like on here, it is much wider than on there. So if we look at the gum from this angle, maybe it's more obvious. It sort of protrudes out a bit more. And so I would like to bring that in a bit. We call that the root torque. And it's more of like the angle of the teeth. And go around to the other side, push some teeth in a little bit, straighten that out a little bit. Right. And then maybe like the angle of this is a bit. Yeah, so it's a very sort of continuous process. Like if I notice this part, then I start to fix it, and then sometimes when we move this, then the other one also needs to be moved to make sure it's in line. And then yeah, maybe a bit more like that. Then we look at the whole thing again. The dots that are popping up, it is like a automatic detection that this movement that we are doing is more difficult and it may take more aligners to achieve. So it's got a movement assessment. I'll just turn it off for now. But it's also a good guide to know, like, if this is going to be more difficult, then maybe the patient has to be really aware that they will have to be really good with wearing the aligners. And then also I have that discussion with the patients, like, how much time and commitment do you want to put into your Invisalign? Because I do have, I think everyone has their own sort of tolerance. Having Invisalign is going to change your lifestyle. I would say that's to be blunt about it. But how much are you willing to accept that? I think that's something we can have a discussion about. And we, for example, like the little dots that we saw, that those teeth we might move less. For example, if a patient told me that, look, I don't think I'm going to wear that well, and let's tweak some stuff that may not really affect how the outcome will be, in order to make things easier in the whole process. So it's a very, I would say it's a very customizable treatment. And yeah, it's quite fun actually to do this. I enjoy the design process. Yeah, and you can see I aligned them before, but then I'm doing that again because I'm looking at the biting as well, how the top and bottom teeth fit together, and we can see that there's some issues there. The center line is not matching, and there's some gaps in the biting on this side, and this side is too close together. So that's something I need to fix, but let's go to the center line first. So again, if we turn on this, we can see that the facial center line, which goes from there, the top center line is maybe slightly to the right a little bit, so it should be closer to the left. So I should move the top one, to the right, to the left a little bit. And then how I can do that is by either doing more shaving on this side, to move the teeth over there. But maybe that's not quite enough. Then I might also have to move these teeth to the back. And then move each one. Sorry. Move them out to the back like that. And then that is getting closer to the center line. And I'm going to reduce a bit of the shaving on this side because that also helps to push on there. And I can push this further back a little bit more. I think I need a little bit more. Yeah. Okay, so that's a bit better. In terms of the center line, now it's matching. But then now again, the way the teeth bite together, it has to change again. So let's go and do that. Okay. I'll say that's a rough okay. So automatically as I move the teeth, the system suggests the places we should shave. I don't like to shave between the molars. I usually try to avoid the molars because the molars are quite large, and also so that's a lot of tooth that I would have to IPR or shave. And also the other reason is that the molars tend to be the ones that decay the most because they are at the back. Maybe they're harder to brush, more food gets stuck between them. And this particular molar, the first molar, erupts at 6 years old, 6 to 7. So it's been in the mouth a long time. Sometimes it's not in the best condition. So I wouldn't want to, I would try my best not to shave those. And then the places where I tend to shave would be where there are the black triangles like we talked about just now, and also nearer to the front because again there's less tooth that I need to shave off between there. And you know, as you saw as well, usually the teeth are more triangular, so they're touching just at the tips, and when we shave we don't need to go like 0.2 through the whole thing. We go through just where they touch, and then the rest is already a gap there. So the actual amount that we remove from the tooth, it's going to be much lesser. So I feel that's a bit nicer, a bit more conservative. Yep. And again, you know, this tooth is quite a good example. You can see how it's not in the correct position, but from the front it looks straight because due to the position it was in, it was sort of tilted inwards, right? It was turned inwards. The top of the tooth has worn down differently, so it's a bit higher on this side and lower on that side. And when I straighten a tooth, according to how it should be, if you look around the back, it should be more like this, right? This is a bit straighter. And maybe we have to move it out a little more. Turn that off so you can see. Yeah, something like that. Looks a bit straighter from the back. But if we go to the front, you can see how that's really looks tilted because this tooth is chipped off on this side, and so when it's in the correct position it looks slanted because the top edge is chipped off. So in this case we have two options. One is either we leave it in that correct position, and you can see how in this position there's much less sort of black triangle or gap in the gums, and then we do a filling at the end of Invisalign to patch that up to replace what was lost, the tooth that has been chipped off, and that will look straight as well. The other way we can do it is if the patients do not want to have a filling and they want something that looks straight from the front, is I could do that, and then that would make it look straighter from the front, and it, you know, for all intents and purposes, anyone that's looking at you would not be able to tell that that's actually slightly tilted to one side. But in this case as well, the downsides would be that you have a bigger sort of gap at the side, and if we look closely, it is closer to this tooth than that tooth, but it looks straight from that side, right? So again, it's all about options. I think there's no one option that works for everybody. It's something that I would go through when I do my planning discussions with the patient. So I'm going to leave it like this first, and then there's a tool that, can't really show that now. But what I could do is to make it look straighter. The other option, the third option, is actually if you didn't want to do a filling and you didn't want a gap there as well. And so what I could do is to, at the end of the Invisalign, just lightly flatten the tooth, just polish it flat. And it's not going to be perfect because in order for that to be perfectly flat, I would have to go from there, which is a lot more tooth than I like to polish off. But if we do this and sort of do like a line of best fit, you can see how that sort of jutting out bit can be flattened off, and how there as well on the tooth next door we could do a little bit of that, and that would also take care of that unevenness. So this is also something that I offer, I would say as a service. I don't charge for that for all my Invisalign patients, because I just feel like the little things like this, it just makes a bit of difference in the final result. And okay, I'll leave it like that, and we'll have that discussion with the patient about the bottom tooth. And we look at the top one again at the biting. It's still a bit out on there, so I might move those teeth inwards a little bit more. And you can see as I move the ones in the front in, then I have to move that one in to match. And then turn a little bit, and we look from the side, make sure that's all looking correct. Change a bit of the angles. This should be a bit more outwards. And yeah, we always make sure that from the front, it should look like all the teeth are matching, that the surfaces are matching. And you can see also this is something that is quite interesting. We don't really notice the front teeth, but they are really quite different in their shapes. You know, this is very flat, and this is a little bit more curved towards the bottom of it, and this is flatter. So sometimes I do have patients telling me, oh, I can feel like it's not quite straight, and it's because they've picked up on these sort of slight changes in the surface. And then what we can do is either we could move the root out a little bit more, and that gives that support closer to the bottom. Or sometimes it's something that we really cannot change. But it's interesting how these very slight things make such an important have such an important sort of feel when we straighten the teeth. Okay, that looks pretty good. So let's look at how this looks in the face. And let's do an update there. So again, this is not the before, but this would be the before. And then let's wait for the after. And this is a nice simulation that Invisalign does, because then, a lot of things that look fine here, we start to see, it looks a bit longer over here still compared to the left side. So then, based on that, I would adjust the teeth and make them a little bit higher. I might also actually tilt that a little bit because it looks like it's slightly turned to there. And I do just push that in because I just feel like it looks a bit out on there. And yeah, there's this sort of black space here, which is actually how the teeth shape is on there. And some patients don't mind it. Some patients, well, I would say the usual ideal that you see, like ideal shaped teeth, they have a smaller gap between the teeth. And so, for example, I could do a bit more shaving, and that pushes them together a bit more. And let me just update that so we can see how it changes the smile. And that's still loading there. And there we go. You can see how that's a little better. And also that we've moved the teeth up, it looks a bit more even. It is still a bit longer. If you are very observant, you can still see that this edge is a bit longer. So I could continue to push it up a bit more, or because the patient has told me during the consultation that they don't like this chip here, the other option that I will give her is that at the end of the Invisalign again, I could polish that flatter, and that is going to make both teeth more symmetrical in terms of the length, and also reduce that little chip there. Of course, the other thing you could do to hide the chip is to do a little filling here. And with the filling, the advantages is that we could also make this little gap a little less wide. So that is another option. But in this case, the patient has told me that she doesn't want a filling here, and we discussed that little shaving before. Yeah, so that's what we are planning for. And also in this case, because her tooth is quite long, that little bit of polishing is not going to make it look disproportionate. Whereas in another person who has a lot of wear and maybe like a shorter tooth, we might choose the filling option because then it would make her tooth look a bit longer, less wide. Yeah, so these sort of considerations. So if we look at the tooth again, before was like this, after is like this, you can see the center line is shifted to match with the face. The teeth are sort of in a curve and it's more symmetrical. The front teeth, because we've pushed them back in, look less wide, and the side teeth look a bit bigger. So it's more of like a gradual, big, medium, small, sort of gradual change as we move to the back. And also the whiteness of the smile, you can see it's much improved compared to before, where you could sort of focus just on the front 4, maybe 6 teeth, and there's some shadows at the back. This is a bit better. Again, this is still a draft, so when I meet the patient and we go through with her, and if she wishes to have a bit more of a narrower smile, less wide, because she thinks it's too, maybe not her personality, we can still make those adjustments. So that's the beauty of doing Invisalign or clear aligner treatment compared to fixed braces, because in fixed braces, we put the braces on and then we see how it works. And then sometimes you can't really tell how the teeth will look like until you take the braces off, and then that's a bit too late, because then you think, oh, maybe this should have been a bit more inwards or outwards, but the braces are already off. So the beauty of this planning is that we can have a better idea of where we want to end up, and it can be more efficient in terms of achieving that ideal look from the start. Yeah, so yeah, I hope that was interesting, and I will be going through more cases with Invisalign. And if you have any sort of particular things you want to look at, please let me know so that I can go through them as well. Thank you so much. Bye.